This presentation will go over the basics of age-related macular degeneration, presented by Molly Hosking, occupational therapy student from Spalding University. Age-related macular degeneration, often abbreviated as AMD, is a degenerative acquired disorder of the macula that causes irreversible loss of central vision from fibrous scarring or reduction of the retina. There are two different types of AMD. The first one is wet AMD, which is also known as exudative AMD. This is the growth of abnormal blood vessels in the back of the retina from the choroid that can lead to damage of the macula when they start to bleed, leak, or scar. Now, it's important to note that any stage of dry AMD can turn into wet AMD. Now, for dry AMD, this is also known as non-exudative or atrophic AMD. This is a gradual breakdown resulting in the macula becoming thinner, the retinal pigment epithelium, and the accumulation of drusen's, which we will note later on. It's also important to note for this condition that you can have drusen's but not have AMD. The following section will go over the anatomy of AMD. The choroid layer is made up of blood vessels that support the retina. The retina is the light-sensitive layer of the eye that helps convert light into images. Between those is the pigment epithelium. This provides a barrier to photoreceptors in the choroid that transports nutrients, light absorption, and acts as a barrier between blood and the retina. Now, photoreceptors, these are found in the retina, and there's two different ones called cones and rods. Cones can help see with color and light, which are found mainly in the macula, and rods can help with night vision, which are mostly found in one's peripheral vision. As mentioned before, the macula, this is found in the retina, and it's a small circle that is responsible for central vision and seeing the finest detail. Now, with AMD, there are some drusen's that can occur, which are white and yellow spots found under the retina in the macular area. This can lead to vision loss if enough large deposits have been developed. AMD is often diagnosed with an eye care specialist through a dilated eye exam. According to the CDC, AMD is prevalent in about 1.8 million Americans aged 40 years and older. An additional 7.3 million have large drusen's and are at high risk of developing AMD. And AMD is the leading cause of permanent impairment of reading and fine or close-up vision among people aged 65 years and older. Risk factors associated with AMD include smoking, which does cause a 2 to 3 times higher chance of developing it, if you are Caucasian, if you have a family history of AMD, being female, having a poor diet including excessive consumption of vegetable fat, as well as excessive exposure to sunlight. The visual effects of AMD can include the following: of blurry vision, distortion, which usually occurs when seeing straight lines turn into wavy lines, central visual field deficits but normal peripheral fields, a central scotoma, which a scotoma is a blind spot, the need for increased or decreased lighting, decreased contrast sensitivity, avoiding glare with sunglasses, hats, or visors. Sometimes people can develop the Charles-Bonnet syndrome, which is visual hallucinations where your brain is filling in visual information due to the blind spots. Now, it is important to note that AMD will not cause total blindness. There are various methods of medical strategies to reduce AMD. Treatments for dry AMD can include taking the vitamins of AREDS2. These can show the effects of slowing down the disease. And recently they have found injections in the eye can be found to stop geographic atrophy, which is found in advanced AMD. Treatments for wet AMD can stop the bleeding, is done through injections in the eye, as well as having high levels of antioxidants and zinc consumption in your diet. For non-medical management, the following can assist those in everyday life to adjust to their vision loss: the use of optical aids such as magnifiers and glasses, lighting adaptations, learning eccentric viewing techniques for increased performance when reading with a scotoma, utilizing support groups, avoiding glare with sunglasses, using adaptive equipment that utilizes tactile and auditory senses for completing everyday tasks, visual skills of tracking, scanning, and tracing, as well as learning non-visual aids and skills depending on the severity and progression of the disease with assistance from low vision rehabilitation. Visit www.kylionseye.org/low vision resources for more information regarding low vision resources that could benefit you or your loved one.